They say they are cutting 35,000 healthcare positions at Veterans Affairs, and they want you calm because the jobs are unfilled. That word is doing a lot of work. Before I break this down, follow this account, because I explain how government decisions actually hit real people, not just press releases. VA says these cuts will not affect veteran care. They say the roles were created during COVID. They say they are no longer necessary. Here is the uncomfortable truth. Unfilled does not mean unneeded. It means they could not hire fast enough, pay competitively enough, or make the system workable enough. Doctors and nurses do not avoid the VA because veterans need less care. They avoid it because bureaucracy burns people out before patients ever get better. This is second-order thinking. When you freeze hiring long enough, understaffing becomes invisible on paper. Then you call the shortage excess capacity and cut it. The system looks leaner. The spreadsheet looks cleaner. But wait times quietly stretch. Burnout quietly grows. And when demand spikes again, the system is weaker than before. Comment VA if you want a simple breakdown of how workforce cuts like this usually show up months later, not in today's headline. This move also tells you something bigger about government money. When budgets get tight, the cuts start where the consequences lag, not where the cameras are. Veterans will not feel this tomorrow. They feel it later, when appointments take longer and care gets harder to access. This is why I teach people to read policy the same way investors read earnings calls. Not what they promise, what they prepare for. What happens next is predictable. Either staffing pressure quietly returns or emergency funding gets requested down the road at a higher cost. If you want to learn how to spot these signals early and understand how government decisions ripple through healthcare, money, and your own planning, that is exactly what Bank Smartly is built for. The next step is already laid out. The link is in my bio.